and get started. So welcome everyone. I'm so excited to be here with you all and all of our amazing panelists for our first town hall. This is being recorded and will be available after our session. So we will send that out. It'll be available on our website. While we do not offer CEUs, we do have certificates of attendance. So you can fill that out and get a certificate to demonstrate your leadership and advocacy in mental health. Please continue to keep checking in the chat. And I'm going to go over briefly just a little bit about what we'll be doing this evening, some background on why it matters, and then we'll kick it off and turn it over to our presenters. So welcome to our Youth Parity Town Hall. My name's Kelly Davis. I use she, her pronouns. I'm the VP of Peer and Youth Advocacy at Mental Health America. I'm also a person with lived experience. And in preparing for this, I was reflecting on my own lived experience as a young person, particularly as a high school student. When I was 16, I had a suicide attempt that landed me in the intensive care unit in inpatient psychiatric care, and was told that the only way I could leave inpatient psychiatric hospitalization was through an eating disorder program because I was struggling with anorexia. However, my insurer said they would provide payment for inpatient, they would provide payment for outpatient, but they would not provide intensive outpatient payment. So I was in an extremely sensitive position right at this moment of crisis where, I had just tried to take my own life. I felt like a massive burden. I was left to then feel like an additional burden on my family and the people around me, because I saw that my only way out of this situation could be requiring my parents to take on thousands of dollars in debt. It was eventually sorted out with the help of some folks, but for many, it is not. And then, what happens for so many people when we are telling them to ask for help, and at the same time, the places where they go, they face kind of insurmountable barriers in many ways to getting connected to support. So more broadly, that is some of my lived experience. We're at a time of profound mental health challenges across all ages, but especially among young people. Suicidal thoughts, suicide attempts, depression, anxiety, stress. It's not just a COVID thing. These have been trending upwards for more than a decade. And while we have countless people asking for help, we also, thankfully have a lot of campaigns telling people it's okay to talk about mental health, it's okay to ask for help. Yet when many young people ask for help, it is not there. More broadly, people rarely have access to more comprehensive resources like peer support in the community, like mental health in schools, like mental health in the workplace. And then when they're looking for professional services, like therapists, like psychiatrists, people are often left to pay out of pocket or go without care, because instead of getting to make decisions about their own personal well-being and what matters to them, they are subject to the arbitrary whims of health insurers, who are then making decisions about people's lives when they are actually doing the thing we're all telling them to do, which is ask for help. We know this is common, and we have significant evidence to show that insurers treat mental health services different than physical health services. When you try to get mental health care, you are far more likely to be denied by your insurer compared to when you try to get physical health care. Fortunately, we are in a moment where we can take action to help stop insurers from unfairly denying mental health care and leaving people to fight for themselves. So today we'll be discussing that moment, what it means, how to get involved, what is mental health parity. We'll hear from leaders at Mental Health America and at the Kennedy Forum. We'll kick it off with David Lloyd from the Kennedy Forum on background, current policy issues. We'll have a panel with Jill King, Madison Watts, and Diana Chow, who are youth leaders and leaders from MHA's Youth Network. And then Karen Howard, MHA's Senior Policy Director, will take us through what is a comment, like what does this mean, how do we get involved, and really go through the process of how you can make your voice heard on a critical issue at a critical moment. So now I will introduce David to kick us off with a presentation on parity, what's at stake, what's possible. We'll hear from him for about 15 minutes. I'm so appreciative for everyone sharing in the chat, checking in. I'm really just grateful to be in space for you or with you at this moment. And please feel free to drop your questions in the chat while David's speaking, and we can go through those with the second half of the time that he has. So David Lloyd is the Chief Policy Officer at the Kennedy Forum, where he's an expert on a range of mental health policy issues, including insurance coverage and the Mental Health Parity and Addiction Equity Act of 2008, which we will hear about. Yes, please give. I found out about the little reactions today. I was like crying with all the heart reactions. So please do that. And keep dropping. Awesome. Keep dropping things in the chat. And you'll hear more about that today. Earlier in his career, David was a legislative assistant to U.S. Senator Debbie Stabenow from Michigan. So I will turn it over to you, David, to share a little bit about what's happening and what folks can do.
Well, thank you, Kelly, and thank you everyone for joining. Really thrilled that Mental Health America is putting on this town hall. It's really critical time, for mental health, and now we can really, make a difference in helping people access the care they need. So my name is David Lloyd, Chief Policy Officer at the Kennedy Forum. I am also someone with lived experience. During college, really struggled. And when I needed help in college, I was actually lucky enough that my college had free resources and free access to therapists, which is really how it should be for everyone. That people shouldn't have to struggle to get access to the services they need, and the services were there when I needed them and made all the difference in the world. And so, that's really what we want everyone to experience. So, and that's what mental health parity is really, all about. So we're going to talk a little bit about what the proposal is at the federal level. And it's all about making sure that insurance companies are paying for mental health, just like they're paying for physical health. And so I'll go to the next slide. And sorry, I think I went one before, but so, let's talk a little bit about what the world was like before mental health parity laws were put in place. And this actually takes us back a couple decades and more to before any of these laws were put in place. And before mental health parity, there were complete exclusions for coverage for mental health and substance use services. So if you needed mental health and addiction services, and your health insurer would say, those services are completely excluded and we're not covering anything that you need. There were also lifetime limits as well as annual limits on mental health and addiction care. So this was a dollar amount where they would say, well, you've hit your cap. Regardless of whether you need more services, we're not paying for anything more. So many people hit these caps on an annual basis, and many others hit lifetime limits that essentially meant they could never get mental health and addiction coverage, even though they needed these services. We also saw separate deductibles for mental health services, and a deductible is simply the amount that the patient must pay before the insurer pays anything. And these deductibles can often be $500, $1,000, $1,500 or more. And even if you had met your physical health deductible, there was a separate mental health deductible. And so you could have paid out of pocket for a bunch of physical health services, needed mental health services, and then they say, well, you have another deductible over here that you have to meet, which really compounded the burden on individuals and families trying to get these services. There were also very commonly limits on mental health visits and days of treatment, usually on an annual basis. So they would say, you only get 10 mental health visits a year or 10 days of inpatient treatment a year. And once you hit that cap, you are out of luck. And that could be devastating. If you need particularly more intensive services or just needed to see a therapist on a weekly basis, you couldn't get the coverage you needed. And, so you'd either have to pay out of pocket. If you could do that, go into debt, or simply not receive the services that you need. So in short, there was widespread discrimination before the federal parity laws were put in place against individuals with mental health and substance use disorders. So the promise of mental health parity was getting rid of these barriers and making sure that there was equity between mental health and physical health coverage. So in 2008, Congress passed the Mental Health Parity and Addiction Equity Act, which broadly prohibits coverage discrimination against mental health and substance use as compared to physical health. And so this statute, which is the law that Congress passes and signed into law by the president, 5 years later, the federal agencies finally put in place more detailed rules to carry out the statute. So this is really, these are more detailed requirements that health insurance companies have to follow. And so these requirements have been put in place for a decade now, since we're in 2023. And while there has been some progress and many of the issues that we identified on the previous slide have been addressed, and they're no longer separate deductibles, they're no longer annual lifetime limits. Many of these issues have gotten better. Insurance companies can still continue to unfairly deny and limit care for those who need it. And because of what we've seen, these denials and limitations on care ongoing, there's been a recognition that these decade-old regulations are too weak and that insurers need to be held accountable. So let's talk about some of the common ways that care is being limited right now by health plans, despite the fact that we have the Mental Health Parity and Addiction Equity Act. We still see that key services are excluded from coverage. And one example is if an individual is having a mental health or substance use crisis, oftentimes the most appropriate response is a crisis response team to help them in person. Just like you would have an ambulance come to a physical health emergency, a crisis response team can help in a mental health emergency. But many health plans still continue to exclude coverage and don't pay for these services, just as they would, just as they would pay for an ambulance in a physical health emergency. We also continue to see denials based on, quote unquote, medical necessity. And this is just kind of a fancy term for meaning that, your provider recommends a service that is consistent with accepted standards of care, but yet the insurer, can say, we don't think, based on our opinion, that you need that care, even if in fact it is needed. And so an example of this could be, someone could be hospitalized, for a mental health condition, be discharged from the hospital and need continuing services, like a partial hospitalization or intensive outpatient services, and the insurer may simply refuse to cover it, or they may say, we're not going to cover ongoing care, despite the fact that you need it, or we're only going to cover a couple days of care, even though your provider says that you need more. So that's another way that care is often limited. And then we often see, and this is actually one of the primary ways that access is limited for individuals, is that there are simply no available providers in network that they can make appointments or that they can be admitted to facilities. And this is a chronic problem that we see, that there are inadequate networks. There are also ghost networks where the insurer directory has a list of providers. You call up the list of providers, and again, they do not have any availability, even though they participate in the insurer's health insurance network. And so some of the driving factors that result in inadequate networks is low pay for mental health providers, and also policies that really discourage providers from accepting insurance. And so these things need to change. We need to increase provider pay so that they'll want to join insured networks, which is where you have the least out-of-pocket costs for care and the most financial protections. Which that's what health insurance is all about, is making sure that you get the coverage you need in an affordable way, that you couldn't afford it out of pocket, because very few people have the resources to be spending this money out of pocket for care, but that's too often what they're forced to do. So the good news is that the Biden administration has put forward much stronger rules for the Federal Parity Act. And these stronger, what are called regulations, are meant to ensure equal access to mental health and addiction care. But right now, they've only been proposed, and we are in a comment period right now, and they have to take these comments in, consider them, and then they'll work to finalize final rules that will then replace the existing rules. And while these proposed rules would really be about ensuring equal access to mental health and addiction care. Right now, the current rules are not really focused on, at the end of the day, whether individuals can access the care they need. And so this would shift the focus to ensure that health plans are giving access to care for mental health and addiction, just like they would for physical health services. The proposed rules would also require health plans to prove using data that they are not putting a greater burden on mental health and addiction care, as compared to physical health. And there's also a special emphasis on the availability of in-network providers. And this is critical because this is, again, one of the primary barriers that people run up against, is that they can't find a network provider for the services they need. And when you can't find an in-network provider, you're too often out of luck. You have to either go out of network and hope that there's some insurance coverage, or you have to pay out of pocket too often, and many people cannot afford to do that, or they have to go into debt, which can be deeply damaging, to their finances and their future. So, overall, the rules that have been proposed, by the federal agencies, are very strong. Yet, unfortunately, the administration has proposed some harmful exceptions that really weaken the rules, and that we think insurers will try to exploit in order to, continue to not, reimburse for services they should pay for services they should be paying for. And we also note that these harmful exceptions aren't even in the underlying statute, which is the law that Congress passed and was signed actually by President George W. Bush back in 2008. So we'll go on to the next slide of what you can do. And one of the key ways that you can advocate for strong rules and to make the promise of mental health parity a reality is to comment, is actually to submit comments to the federal agencies and tell them that you want strong rules without exception. The good news is that the administration is really taking the initiative to try to improve access to mental health and addiction care. So they want to do the right thing. But they have unfortunately put in some components of the rules, which we unfortunately think will weaken the ability to make parity a reality. And we think that insurers will essentially try to use these exceptions in the current rules, to continue to not cover care that they should be covered. So in order to comment, you can use the comment portal that Mental Health America has available to tell the administration to finalize these proposed rules and to get rid of these problematic exceptions. And in the comment portal, that has form language that you can use, but you can also add your own story, which is very important. You don't have to, but it's very powerful if you share your own story, because federal regulators may well take examples. They won't identify you directly, but take examples of the types of stories that they've heard and why they're finalizing strong rules. So, in summary, your voice and story are urgently needed. I have no doubt that as part of this comment process, opponents of these stronger rules will be commenting, and they'll be saying why they think the rules that have been proposed are too strong and why they should be weaker. And in fact, when we need stronger rules without exception. So in order to help the federal agencies say, no, we're not going to listen to these comments that are opposing the rules, we need a lot of comments and that really say why these issues are so important, from organizations like Mental Health America and the Kennedy Forum, as well as from individuals who are directly affected and who want to see mental health parity a reality. So thank you for the time. I'm happy to answer any questions you have. Really appreciate your advocacy it is so important in order to make the promise of this law a reality, and help people get the care that they need in a way that we would never think that these services are denied for physical health in the way that they're denied for mental health and substance use. So thank you so much.
Thanks so much, David. I'm gonna really appreciate you sharing that with us. I think in many ways, certainly insurers, but a lot of things that happen in the insurance industry in particular are built so that it is actually really hard to understand if you're not a specialist in this area. So I think it's really important and was really helpful to hear things in more kind of general terms. I want to ask a couple questions. So one question that was asked by multiple folks, can you share more about the problematic exceptions? What are the things that, what are the exceptions to the stronger rules that insurance companies are most likely to exploit?
So, the federal agencies, they put in a number of stronger requirements for the health plans, but they've said there are two exceptions where they won't have to meet the stronger requirements. One is if plans are following, clinical standards, which they really don't define. And two, they say that if plans are working to prevent or combat fraud, waste, and abuse, they don't have to follow the rules. The problem with this, and we completely agree that plans should be following accepted clinical standards and should be actually taking steps to make sure that there's not fraud and abuse in the system. But the way that they have structured it, every kind of legitimate treatment, when people actually need care, any attempt to limit that care will just be described as, oh, we're following clinical standards, or, oh, it's waste, fraud, and abuse. And so we're not saying don't take these things into consideration. What we're saying is rather than exceptions, these following clinical standards and combating fraud, waste, and abuse need to be the same for mental health and addiction as for physical health. And plans need to show that how they're doing, how they're following clinical standards and how they're combating fraud, waste, and abuse, that it's equal for mental health and substance use as compared to physical health, which is always the fundamental requirements of the Parity Act. Is there's equality between the two, and by requiring plans to do that, you allow them to use clinical standards, and you allow them to take steps to combat fraud, waste, and abuse, but you're not allowing them to use it as a loophole to basically not follow any of the rules. And so that's why it's so important that we require health plans, to show that they're doing it, that they're applying clinical standards, and that efforts to combat waste, fraud, and abuse, that they're the same on the mental health and substance use side as they're doing on the physical health side, and that they're not just imposing really stringent rules that actually limit access to needed care in a way that they would never do on the physical health side. So that's the fundamental problem with how they've structured it. And so what we're saying is don't include these exceptions to the rule, but in fact embed these two considerations within the rules themselves, of parity, so that we're not just creating giant loopholes that plans will be able to exploit.
So if I'm understanding correctly, basically, insurance companies can just say, oh, this is about combating fraud, or, oh, this is, and then there's no further.
Yeah, so essentially they could say, well, we're denying this care because we think it's waste, fraud, and abuse. And it would be very, very difficult for the agencies to stop this, and would put the burden back on individuals to try to prove that that's not the case. And we have so much experience over the last 10 years with the current regulations that the burden, it continues to be pushed to individual patients and to providers for them to prove how their insurance company is violating the law, which no one can do that. We need the agencies to do it, and we need strong rules that we can identify, where health plans are inappropriately, denying care.
I understand what you're saying. I don't know that it makes sense. I want to ask a couple more questions from the chat. So Erica Rutledge said, how can we best advocate for patients and ourselves when insurance coverage is denied for mental health services now? For example, Medicaid does not cover access to eating disorder treatment in our state, and few EDO specialists take Medicaid, leading to a significant gap in access for youth from marginalized communities.
It's a big issue that's been that the person who wrote in has identified. Eating disorder coverage is unfortunately still a big problem, and both the federal agencies, but also state Medicaid departments need to do much more to enforce the existing parity rules to ensure that people are getting the coverage they need. So, I would encourage you to, reach out to your local MHA chapter. Also, reach out, and they can help you contact the state Medicaid, agency to make sure that you're bringing these issues to the attention of the people who should know about them, and demanding that they take action to change it, because it's not right when people are denied services or don't have access to services that they should have access to. So definitely encourage you to work with your local MHA chapters, and contact your state, and make sure that they know how you feel and what you're seeing, and so that they can take action to change it.
Thanks, David. I wanted to ask another question from Blake Matthews, who said, what is being done to increase insurance companies covering gender affirming mental health care? There are a lot of bills and laws trying to ban gender affirming care, which has been shown to negatively impact the trans community.
This is a huge concern. We're seeing attacks across the country on trans youth and individuals for gender affirming care, and mental health parity can help. Can help. There are diagnoses within mental health diagnoses that gender affirming care is critical to addressing the mental health diagnoses. So it's important to advocate in your state legislature, and we're going to continue to push at the federal level to protect trans youth and individuals from these ongoing attacks. But it's these attacks are deeply harmful to individuals, and all of us need to stand up and say that they're not acceptable, and make sure that we're using all the tools that we have to protect you.
Okay, one last question that will help us transition to our next conversation as well. So it's a good transition question. So Sophia Rose asks, hi, I'm happy to be here and love listening to you guys. Thanks for being here, Sophia. I'm just curious, as a high school student, how can I get involved in these issues? I'm 16 and also have experience with getting insurance for therapy and my friends as well. And it's so awful to watch my peers' inability to get the help they need. But I can't vote and I'm young. What can I do?
First of all, you encourage you to comment. There's no age limit on commenting on the proposed rules, but I would encourage be active on social media. Tag your member, your elected officials, and go and meet with your elected officials, your state representative, your state senator. Find out where your member of Congress is going to be and go talk to them. It's often by showing up in person can make a huge difference. And organize with your peers. The youth voices are so critical right now, and are driving driving the conversation on mental health forward, driving important advocacy on access. So now is the time, to really be engaged and to organize with your friends, and let adults know why this is so important. and let your elected officials know why it's so important. You're only a couple years away from voting, so they should know that the tide is turning, and that that they have to pay attention to.
Thanks so much, David. We're going to transition to our youth panel, but I just really appreciate you joining us this evening. It's very late, so thanks to all of you for coming out in the evening. And yeah, thank you so much for your dedication and all you do in this work, and also for sharing some of that with this group this evening. We're going to go through and talk about how this impacts young people, but we're also going to go through the actual kind of commenting process as well. So thanks so much. I see some thanks in the chat, and just appreciate you joining us.
No, thank you so much. Really appreciate it. And thank you again for all your advocacy.
Thanks, David. All right, so that was wonderful. Thanks for all the thanks in the chat. It's great to just be in space with you all who care so much about this issue. I think a lot of times it's hard to really find places where you can even learn some of this information and talk through it. So here's how it happens, where it begins. I listened to Hamilton too much. Here's where it happens, here's where it begins. And now we're going to transition to our youth leaders panel. So I first am going to introduce our facilitator and then go through the bios of our three panelists. So first up is Karen Howard. Karen currently serves as the Senior Director of Policy and Advocacy for Mental Health America and has 14 years of experience in legislative and political affairs and advocacy. Howard advises and carries out the policy and advocacy strategy for a national community-based consumer nonprofit organization whose mission is to put the voices of people with lived experience of mental health conditions at the helm of decision-making at both the policy table and in healthcare settings. She educates and persuades federal and state policymakers to act on a wide range of issues that impact individuals with mental health conditions, including healthcare, education, criminal justice, and housing, and she facilitates relationships between state and local MHA affiliates and their federal and state public officials. Yeah, just to what David was mentioning, we are MHA's national office. I think there's some folks from state and local MHAs here as well. So there's lots of different places to get involved across the country. Now I will turn it to introduce Diana Chow. Diana is a first-generation Bowie Chinese-American immigrant from Southern California. Diana founded Letters to Strangers when she was a sophomore in high school after bipolar disorder and a blinding eye disease nearly ended her life. Today, L2S is the largest global youth-for-youth mental health nonprofit, directly impacting over 35,000 people annually on 6 continents and publishing the world's first youth-for-youth mental health guidebook for free. Diana is a member of this year's Mental Health America Young Leaders Council. Next up, we have Jill King. Jill is a disability and mental health advocate based in rural Georgia. She was a member of MHA's 2022-2023 Young Mental Health Leaders Council and co-founded the Students with Disabilities Advocacy Group in 2021. And then finally, last but not least, we have Madison. Madison Watts is a junior in high school residing in Montgomery County, Maryland. Throughout the past 3 years, she has pursued her interest in student advocacy by getting involved in several advocacy organizations on the statewide and national levels, and also speaking on social topics that she's passionate about, including mental health awareness, environmental awareness, and educational policy. She hopes to empower youth voices around the nation with her work and get youth directly engaged in crucial conversations. With Mental Health America, Madison has served as a youth voice in many focus groups, a panelist prior to today's panel, and looks forward to continuing her efforts within the advocacy and deepening her understanding of social issues. So great to be here with a bunch of MHA Youth Leader Programs grads. And yeah, I know, our future in mind. And we'll turn it over to Karen to guide us through a conversation on how these issues show up for young people and impact young people specifically.
Hi, everyone. Thank you so much, Kelly. I'm really honored and excited to be here as someone who first started experiencing kind of signs and symptoms of anxiety in middle school, but never really connected to any services until, about 10 years later in undergrad. It's it's really exciting to be a part of helping to educate and inform the next generation of leaders. So please do drop your questions in the chat. This is an open discussion, an open forum. Right after this panel, we'll have a question and answer session where we'll talk more about the submission process, as Kelly mentioned. We did drop the link in the chat, but we can talk more and walk through that process. I want to begin just by explaining that the goal of this youth panel, as Kelly said, is to explore youth perspectives on the kind of insurance coverage policy issues that David just discussed. I did see some questions in the chat I wanted to quickly answer, and then I'll turn it over to our panelists to answer our first question. If you all will just start getting your answers ready, we'll ask, can you share a bit about yourself and how you've seen these issues show up in your communities? I'll start with Diana first, and then go to Jill, and then Madison, and then we'll change the order up for the next question. But to answer a question I saw in the chat first, will these rules expand the insurance companies that providers from private practices take? And absolutely yes. The parity rule was exactly the regulation that was created and the law that was created to help insurance companies better cover mental health care. Right now, one of the reasons that private practice chooses not to participate in insurance is because of low reimbursement rates, denials of care, and they're just having to jump through a lot of hoops to file paperwork and stay on the phone in ways that their practices really cannot sustain. So they end up just taking payment out of pocket or cash payments instead of going through insurance. So this rule is absolutely the one you want to comment on to say, hey, my insurance network says that all of these therapists are covered, but they're actually not, and I have to pay out of pocket. That's called a ghost network, and MHA has actually testified on that earlier this year in the Senate Finance Committee. Secondly, I want to just note that when David mentioned you can talk to your elected officials about this rule, the elected officials in your state that you want to talk to are the state health insurance commissioners. You can look those agencies up here. If you want to file a complaint, you can do so through that link that I just dropped. There's also complaints that you can file at the federal level directly with the Department of Labor, who you'll submit your comments to today. And I'll drop that in the chat as well. What I suggest, since this is a lot of information, is just get your story down, just put a couple of bullet points on paper about the trouble that you've experienced and how it's gotten in your way of recovery, of feeling better, of having a life that is even more fulfilling to you than the one you have now. And once you get that down on paper, you can like copy paste it into both your state email and the federal email and send it off at the same time. And hopefully you'll receive a response. If not, you should get right back. So not to get us too far off topic, I want to bring us back to the rule and the panelists that we have here today. Diana, would you tell us a little bit about how these issues affect you directly and how you see them showing up?
Yeah, for sure. Definitely, like so many others have already mentioned, I myself have experienced the similar problem of trying to seek mental health care and not being able to have it be afforded to me. And part of the transition that makes it difficult is when you go from being considered a child by the state to becoming a young adult. I was originally qualified under Medicaid. And eventually, once you are under adult, some states that don't have that Medicaid expansion, they don't cover mental health services under the on the same way that they do for children. And so I was lucky that I went to a college that had a relatively good mental health care system. But even then, the wait list was extremely long, and most people ended up choosing to go off campus to seek other care, because even if you were to able to see the counselor on the wait list eventually, they would usually limit it to only 5 to 6 sessions, and that's not going to be suitable for long-term chronic, problems that like such as I myself had. So then that adds on another layer of barriers. And going off campus, you don't have, a car as a student. It's just a lot of money issues as well.
So to answer this question, I focus on disability and mental health community care in rural Georgia. Georgia has not expanded Medicaid, and when I looked at MHA's state of mental health, Georgia is currently 47th in mental health workforce availability. Yet when my insurance changed recently, and my therapist tried to get on my insurance's network, went through that entire strenuous process, only for the insurance company to say that they had too many providers in my area. I don't know how they're determining that. That's not true. There's no way that in the true fact of it, that cannot be true. And when I'm sitting with other students working, trying to help them access care, we see time and time again, they'll find a list of 10 providers who would be suitable, especially if it's like specific care that they can't access through our campus mental health system. Maybe one will call them back. And that's just putting continual burden on the patient, a patient who's already seeking out help because they're struggling. And we can't keep putting this burden on youth like this.
Absolutely. Just piggybacking off of what everybody has said, affordability and kind of a limited access to providers is such an issue and a really big challenge. I guess first I'll talk about affordability and in insurance. Even in the insurance capacity, mental health care is still very expensive because you have the deductibles, the co-payments, and all of the additional costs in the fine print. And so there is kind of this financial stress and barrier and burden that just kind of weighs on people. And that should not be a concern when you are seeking out treatment and seeking out help. I'll probably mention this a little bit later, but people are at the point where they're not able to, fully afford and pay for this care. So they turn to websites and online mental health, help, but their information is being exploited and they're not really receiving the necessary care that they were seeking out for. And then, even just tying that into a limited access of providers, as Jill said, there is a shortage of mental health care providers in certain regions, in certain areas. I'm very lucky to, be located in a place where there are many mental health care providers, but they're all very, they, I guess, specialize in mainstream issues, and there's not many for more specific issues. So that is a barrier as well. And then I think, as Jill says, you'll have, doctors and other healthcare providers give you a list of 10 plus places and people to get treatment from, but there are waiting lists and there's delayed treatment, and it's really not corresponding with how urgent mental health care is and how much it is needed and how high of a demand it is in. From the student perspective, I guess, I've seen students try to get help, but there's the expenses, the insane costs. And as a student, we really can't put on that burden or really want to put it on our parents either. There's the waitlisting factor, and it's just a really, in general, inconvenient process. That's so much work to put on youth. And it's a negative feeling as well.
Thank you all so much. Does anyone want to chime in on some ways that intersectionality plays a role in this?
I was on mute, my bad. Sorry. Classic. Well, so just like Madison said, with the lack of, providers, over 80% of mental health professionals in the US self-identify as white. And we are on track to see a majority minority US population, especially in the youth demographic, just within the next few years. And so that what that means is that we're seeing mental health providers not necessarily matching the demographics they're serving. And I know I myself saw this when I went to a therapist for the first time and I was trying to explain my family situation. And at the end of it, they just turned to me and said, I see you have one of those classic tiger parents. And I was so shocked because everything I was trying to say was the antithesis of that. And my parents were not like that at all. But that was the first thing and only thing that the conversation really saw. And so that also ties into the whole lack of access when it comes to insurance options, because if you don't have many network options, in-network options, you already are going to have an even smaller potential selection to choose from, who might better understand you, who might have that cultural competency. And then on top of that, insurance companies oftentimes will say, well, they will, consider it a medically necessary treatment if it is a type of therapy that has recently, or the latest research shows, is best fit for this type of diagnosis. But sometimes things like CBT, cognitive behavioral therapy, might not be the best choice for someone like myself who came from a very collective culture where talking about myself, my own feelings, was very difficult and felt very hard to overcome at first. And so working on my physical symptoms through, say, EMDR, for example, worked better for me, personally speaking. But those options are oftentimes not available when there's so many insurance barriers in place.
Absolutely. I feel like when it comes to intersectionality, like in my experience as a disabled person, whether that's like needing providers who are still COVID conscious, whether it's with CBT, when you have CBT with marginalized communities, you can't always think your way out of a marginalized experience. You can't think your way out of oppression. So it's when you're working through these issues, you need someone who might get it on the same level. And we're seeing that across all marginalized groups, as well as within the disabled community. As the public health emergency is ending, we're seeing rollbacks on telehealth, and that is going to continue to limit access to mental health care and healthcare in general for the disabled community, which is another large part of why we need to be taking action with legislation.
Thank you
Yeah.
all. Go ahead, Madison.
Sorry. Yeah, so I definitely agree with what everyone has mentioned. I think there are, marginalizations that make it really hard for people to kind of, I guess maintain their mental health care. As Diana said, there are certain cultural barriers, and it's difficult because on these lists that you get, and first off, it's already so selective. There's limited people who will reach out to you. It might not work, and then with the not, with your healthcare provider not even being able to empathize with you, that is definitely a problem, and it kind of makes you feel disconnected. And then I will also say that, there's the economic disparity. So people who are like low-income individuals, they might face additional financial barriers from obtaining, the necessary treatment. And then, kind of correlating with this, I guess, if people don't have support systems and support networks, this can be a critical component. And, it may alter and impact I guess, their access to mental health care and their ability to kind of cope and just cope with their mental health challenges.
And then what happens when you end up going without care for long periods of time? Of course, even if you've tried to get it, you might end up in a crisis and in a situation that's life or death, which could have been avoided. And instead of, addressing this head on, it's taken over, 15 years to really get to a point where we're trying to end this discrimination and in health insurance. So I'll ask one more question. What advice do you have for expanding pathways for mental health policy leadership and involvement for young people in the policymaking process? You guys are doing such a fantastic job of it already. Having your input would just be really wonderful.
I feel like in part it's knowing the right people, which isn't how it should be. And that's why events like this are so important. These open call events that are meant to educate and get you involved in the legislative process. So I think continuing to have events like this is a big part of it. And past that, it's, what's the word I'm looking for? It's finding ways to have this stuff be digestible. Because, when you read that legalese, David did a great job of saying it in like a way that I could understand. But a lot of this stuff is way above our level when mental health affects everyone, no matter what their educational background is. People shouldn't have to have a college degree to understand legislation and advocate for it. So that's my thought.
Absolutely, I 100% agree. And I also saw somebody in the chat who was like concerned about getting involved because they were young, but it is like never too early to get started. You can be at any age and really, take action and take the necessary steps to make change. I know people in the chat were talking about engaging with decision makers, which is huge. But also, I think sometimes that's kind of like a larger scale action that requires more work. And if you're not quite on that level yet, something that you can also do is work to get other youth that involved. So coming to this panel is a great first step, but there certainly is power in numbers. So if you have one person advocating and testifying on a bill versus 50 people, there is going to be a change in how decision makers will kind of view youth opinion on said bill. So really, I think social media, as impactful it is on mental health, it is a great platform to really share opportunities. So I think this is a great way to kind of get other people engaged that and start mobilizing youth members, so we can start working toward action and make kind of information to this accessible to everyone.
Wonderfully and powerfully said by both of you. And I just want to say that, I see there's some comments asking about things like what is EMDR, which there's a brief answer in the chat box. But there's also questions about understanding legalese and what are some coping skills, basic information people can have. And I just wanted to point out that Mental Health America has amazing online resources as well as screening tests you can share with people, and also letters to strangers. We published the world's first Youth for Youth mental health guidebook, and it's for free to download on our website, and it has a lot of different sections, including one on navigating the US healthcare system as well. So that could be something that's helpful for folks since it's written by and for young people. So the language is hopefully easy to understand. But in general, I just wanted to really make sure that you recognize the resources that are out there, because there are a lot of amazing things out there. And once you have those things to really become educated yourself, you can be that force for change in your own community, and your community can be the change for everyone else too. It really starts one at a time, but you can do it. And I'll put the link to our website in the chat, so for people who want to download the book.
Perfect. Thank you so much, Diana. I definitely think people are waiting for that link to the book. You all have just really inspired so much, I think, activity and effort around this issue by sharing your stories, by providing some background about the challenges that you've faced, as well as some ideas for overcoming some of those challenges, and the importance of group advocacy and a whole movement that takes more than one voice, but a coalition of people. And just like all of you all have kind of come from your various states today. I did want to just follow up with one more question. I'll try to weave two into one since we just have a couple minutes. Why is it important to treat mental health the same as physical health? And does technology play a role in that?
To touch on this, as a disability and mental health advocate, I feel like I hear a lot in mental health spaces that if I had a physical illness instead of a mental illness, I would be taken more seriously, which isn't necessarily true. Chronically ill and physically disabled people are treated just as badly by these systems. But when it comes to insurance and parity, that statement is still the truth. And ultimately, mental health parity is just one piece of the healthcare puzzle to make healthcare people centered rather than profit driven. So, and I think someone else can take the technology bit. Yeah.
I will let Madison take the technology bit if that's okay with you, Madison. Does that feel okay with you? Okay. Yeah, because I wanted to add on to what Jill said, because there's a whole concept of psychosomatic symptoms or physical manifestations of psychological distress. And you might think of it as John from Sherlock walking with a limp from PTSD, even though his eyes are technically fine. You might think of it as, panic attacks leading to this burning sensation in your lungs. And for me, it actually manifested as that eye disease that ended up making me blind for about half of high school. All of my tests came back fine. All of the doctors couldn't figure out what the heck was wrong with me. And it wasn't until my mental health started getting better after I sought consistent treatment for the first time in my life that my eye disease got better. And so I just wanted to point that out, because when there's that extra stigma around mental health, especially in a lot of different cultures where that stigma comes into play, your body reacts because your brain controls everything down here too, right? So this is another way how these two things are so interconnected, and why it's imperative we have this parity law really just put into place and solidified.
Awesome. We wanted to try to just weave in any comments that you all have on technology and whether access to technology has an impact on mental health or access to services. So if you have any comments on that, please do share. If not, we can move on to the second part of this, where we actually will scroll through the website to show the Federal Register where people where their comments will be submitted.
Yeah, I think I can speak a little bit on the technology bit. Just echoing what everyone said, just to get a little bit personal, my mom actually told me when I was dealing with things myself that like the brain is part of the body and they hold equal weight in your health and happiness. So caring for your mind is equivalent. So yeah, just to add that. But so in terms of technology, I do think that it can impact mental health issues. I think inevitably, like it will. I think our generation is the first to deal with social media, and we have seen the statistics, we've seen the effects on mental health. So obviously it has its negative effects, but when looking at access to services, I think that it might be beneficial in a way, because doctors will give you a list of 10 people, but within your area you can kind of look and search and do your own research, because I think that like obviously doctors, they're trying to get you in and out, it's trying to be a quick process, but I'm sorry about that. But within technology, you can take the time and search yourself, and obviously it is a little bit of a longer process, but I think it'll allow you to kind of customize who you are looking for, just so you can like I guess reduce reduce the susceptibility for it to be someone who you can't connect with, right? I think technology allows it so you can maybe connect with somebody and get proper care from somebody who you are researching yourself, if that makes sense.
Madison, that's a really good point that I had not really kind of shared in other conversations. Technology can provide additional ability for us to research people's backgrounds and schoolings and trainings and how that fits into what we're looking for in a provider. It's also, a way to learn more about issues. So as you all have mentioned, we have a lot of resources to help share, to learn about what therapies are out there, what options do we have. Technology allows us to call our insurance companies up, on the phone and say, hey, can you help me find XYZ? Because I'm not seeing this in your list and no one's giving me a call back. Additionally, we have to ensure that we're just conscious and conscientious about how technology platforms use our data and whether or not there are terms and conditions that really give up our privacy if we decide to use a platform that says that they're therapeutic or offer therapeutic services. In this day and age, we know that so much consumer information is being sold to marketers that protecting that information can can come down to not using a platform that might otherwise be helpful to us. Thank you all so much for your time today. You're welcome to stay on video. I'm going to share my screen at this time, just so folks who have joined can see how to navigate to our action alert on our website. So in order to submit a comment, comments are ways that our large government agencies try to get information from individuals and organizations that they have jurisdiction over. And sometimes they give you, agencies will put out a rule. The rule or guidance or other kind of update sometimes is in a news release or press release. This kind of way the government communicates with its citizens are a really important way to pay attention to the goals and direction that our government is going in. If we like it, it's really important as a citizen, an everyday person, whether you're a voter or not, to weigh in and say, hey, this is important to me. I'm really glad that you did it, and this is why, and it impacts me in this way. Again, I like to go back to that little story. If you come up with 3 or 4 bullet points, you can always go back to, you know, your bullet point might be, hey, I'm a high schooler or college age youth. I've had trouble with finding a provider that works for me, even though I've called through 10, I've only gotten a call back from 1. This means that I have to go without care and support that would otherwise help me to do better in school, or have other additional activities that I can take on. And what I want you to do is to change policies so that insurance companies have better networks of providers that I can choose from. If you have those 4 bullet points down, then you can copy paste them into any different opportunity to comment. Here we have our requirements related to the Mental Health Parity and Addiction Equity Act. You can also, as I mentioned earlier, submit the exact same bullet points and maybe use some of the language here and send it to your state insurance commissioners. Or, you know, this is actually going to the Department of Labor. There are about 15 major cabinet level agencies, maybe a little bit more, that really meet with the president on their leadership meets with the president or the White House on a regular basis. And getting comments to them is, while they have open comment periods, is one way to even kind of indirectly have your voice heard by the president. So for this rule in particular, you can go to MHA's website. If you go to our website, which is mhanational.org, I just want to make sure everyone can see how to just quickly get to our action alerts. If you go to get information, or sorry, get active and send an advocacy letter, that brings you right to our alert page. And the first one there is the parity alert. You go down to the button, and you can see here, you can read a little bit more background about what we covered today. And some of the examples are the bullet points that you can choose to kind of add or subtract from in your comment. And then you just add your name and address here. Note that everything you put into a public comment is public, so will be available. You don't want to put your address in the actual text of the comment box. You don't want to put you know, other identifying information like your birthday and social security number, anything like that. You do want to, though, include maybe your state or your county and maybe even your city, and why in your area, like Jill was mentioning, in a more kind of suburban area where you're looking for community care, you're just not finding it. And some of the issues that affect you right in your home. Once you submit this, it goes directly from MHA's website to the Federal Register, regulations.gov or federalregister.gov. You can access that either way. This is the main way that individuals submit comments to the federal government. We make it a little bit easier so you don't have to read through these kind of 1,000 pages of text. But if you want to read through that, you're more than welcome to, and I can drop the link in the chat. Anyone studying to be a lawyer might find that it's interesting, or some people just enjoy reading these things. If a rule is not from the Department of Labor, say there's another rule on a comment period that ended earlier this month, that was from the Centers for Medicare and Medicaid, which is an agency under the Department of Health and Human Services. So in order to find what you want in the Federal Register, it's good to know what agency is it coming from. Is it coming from Department of Labor, which you don't automatically think, oh, my health insurance benefits would fall under a labor issue. It just doesn't really make sense right away. But because of the way that the law was written and how enforcement can be done, it is through the Department of Labor. If there's other rules, you may actually need to check into another agency. And the importance, again, of putting in your comments, of sharing this with other friends or family members that might also submit a comment, is really the more the merrier. If the agency receives, 10 or 15 comments or something, they have a little bit of input and they might use it, but then they may also think about, okay, who else can I talk to other than everyday individuals? Oh, I can talk to this huge organization that has hundreds of thousands of dollars in the bank. And let's see, they can probably meet with me tomorrow. And then since they have the capacity and the time and the resources, and then we can just get their help in finalizing our rule and say, and incorporate what they want to say since they're available. But if an agency in its comment period receives 15,000 or 20,000 letters from individuals, then they know that people took time out of their day to put input, and that they need to go through that and really dedicate the time and energy to ensure that any final rule, after the proposed rule, there's a comment period that closes, and then typically a final rule that comes out. Sometimes they give an additional open comment period after the first one closes to respond to comment or give additional opportunity for people to give input if they weren't sure about something and had kind of conflicting views. But then once that second comment period closes, typically the final rule comes out. And the only way to really roll back that rule is either through another regulation or through a lawsuit, or if a new administration comes in and just completely undoes that rule with a new rule. So these are the ways that kind of government operates with public input. And I think from here, we are at a point where we can take questions. And please know that my first time looking at the Federal Register, I didn't think it was for me. I thought, oh, this must be for like someone who's really important, who like has a lot of understanding about government. But no, these rules and regulations are for the everyday citizen. So if you can get with an organization like an MHA affiliate or another youth-led organization like those who are on our youth panel to help kind of parse through this language and understand a bit more. You can read blogs, you can read press releases in the news, you can ask other organizations to help you with understanding what a rule might say, or other kind of folks on campus or in your community, put out an all call to see on your social media if anyone else has been looking at this same issue. Can you guys get together to try to brainstorm and figure out what is the rule trying to accomplish, and is this going to benefit us? Those are ways that you can really kind of digest and understand what the strategy is and the end goal is, and then decide to be involved. You don't have to make a lot of money. You don't have to be of voting age. Anyone and anyone can submit comment. So from here, we can go to questions. Feel free to drop questions in the chat. The more the merrier. Again, if you end up getting questions coming to you or from others after the conclusion of this webinar, feel free to reach out to anyone here and we can help answer them for you after the fact. I will drop my email address in the chat here. And going forward, if you'd like to stay involved with MHA's work, please do sign up for our advocacy network on our website, which has emails going out whenever we have an action alert that is related to an open comment period. And we also have a youth council listserv, or kind of a youth leaders listserv that you can sign up. Our newly revamped youth website, I'll drop into the chat as well. And we'd love to make sure that this is a conversation and that you guys stay engaged and have the support you need to make a difference on the ground.
Thanks so much, Karen. I want to invite you and David to maybe stay on video just to answer some folks' questions in the remaining bit of time that we have. And thank you so much to everyone who's commented and listened so far. People have kind of brought up some different things. I think first I wanted to echo what you said, Karen. The biggest predictor of whether or not someone volunteers is if someone close to them volunteers. So I would challenge folks to maybe send this comment link to 2 people, because the best way to get people involved is to get connected with other people who are involved. But please, if you have any questions in the chat, I did, I got glimpses of this question. I wanted to ask what doesn't this, well, I guess first from earlier, what is the kind of insurance company pushback? What are the things that they're writing and meeting with folks to say?
So I think the insurers will say that it's too burdensome, that they shouldn't have to show that they're in compliance with the law and give any more information in order to do that. They'll say they're already in compliance, which I think we do not. All the evidence suggests that that's not the case. The federal departments have said that the plans are not in compliance. And so it's mostly it's too burdensome. We shouldn't have to prove that we're collect this data to show that we're complying with the law. Which mental health and substance use services are too important not for them not to have to make the effort. People aren't getting the help they need, and we know that people aren't getting the coverage they need, so they should be forced to show that they're in compliance and that there's equitable access to care. But I think that those will be the main types of pushback that the agencies receive.
And then just to follow up on that, I'll just drop a link in the chat to Kennedy Forum's press release on the most recent large comprehensive flagship court case decision on parity, which was WIT versus United Behavioral Health. And in the court case, the insurers argued that it was just, like David said, just too burdensome and too costly to cover all of this. And that has been a lawsuit that first we were really excited about because the class action consumers, the everyday individuals, won and were told that their cases and claims would be reviewed. However, an appeals in that case happened. So there's some ongoing litigation in that case. But if anyone wants to learn more about what are the things that insurers are saying to try to keep from covering and reimbursing for mental health care, they're saying it in that court case.
And I would just add that there are many parts of our system that need to be fixed. And so this is a critical piece of what we have to do to fix mental health and addiction coverage. This is not going to cure everything. So advocacy is critical. But there's certainly many different pieces that need to be addressed. And that's why the Kennedy Forum and Mental Health America are working together across multiple different different policy areas to help people access the services and support they need, and also to prevent mental health challenges and move further upstream, so that we're not waiting till stage 4 before we help.
I've seen a lot of people in the comments. So we're talking about, right, federal level advocacy. I've seen a lot of people in the comments talking about getting involved at the state level. Are there things that people can do at the state level around parity, and what would that be?
Sure. So the Federal Parity Act is a federal law, but state officials actually have a really important role in enforcing the federal law. And so the state insurance department and the state Medicaid agency you help make sure that plans are complying, and too often they're not doing what they should. So by advocating at the federal level to improve the rules, we also help in states, but then we need to be holding state officials accountable for enforcing the federal law. And that can be done both by pushing the state departments. It can also be done through pushing your elected officials, both the governor. Often the governor, the state departments report directly to the governor, but also your state representative and state senator. So all of those people are important to making sure that they're pushing and using their power to push for mental health parity, and ensuring that people can get the help they need.
One of the things that I also just mentioned is, in addition to the state health insurance commissioners, whose link I dropped into the chat, where you can email at the state level, and as David said, your state legislators, which you typically can go to the legislative website, even if you just go to like Pennsylvania.gov or California.gov or Arizona.gov, you should be able to find your legislative body and then put in your zip code or address, and that will pull up your legislator. You can just copy paste the same comment that you sent through MHA's website and send it to them, so that they have a record that there are issues happening with individuals in their state that they care about and that they need to be advocating on behalf of. And some states have passed some really good enforcement, like Colorado and Illinois, and those separate state laws kind of help to give power to the federal law, since they have enforcement.
As two people who've worked on the legislative side of things, I feel like your point, Karen, about when you first saw the register website being like, I think that's how a lot of people feel about contacting government officials generally. Like, these problems are so huge, I don't matter, my voice doesn't matter, no one's going to listen to me. Can you both talk about your experiences on the government side and the importance of individual people reaching out, and maybe any tips that you would have? Because it seems like a lot of folks are interested in commenting, but also kind of broader policy advocacy.
Yeah, certainly. I think it's critical that I worked for a U.S. senator, and we had people drop by the office and want to have meetings, and we would take those meetings. So I think it's important, both if you're in DC, but also locally. You can often, particularly with like state representatives and state senators, they often have offices in your area, where you can go and ask for a meeting on an issue, and you can bring together a group of people who are concerned about the same issues, and tell them your concerns, and coordinate with the Mental Health America chapter, or other advocacy organization, or just go in yourself. But Many of the local elected officials in particular are available, and you can meet with them. And most people don't take advantage of that. And so if you simply go in and show up to where they are and talk to them, that can make a real difference. It's not guaranteed that in every instance that will, that they will do exactly what you want. But certainly if you don't do that, they won't know, and they won't be able to champion the issue that help solve your issue through legislation or through working with the State Department. So it's really important to be engaged and not be shy about doing outreach to your local elected official.
Yes, and I will say that as someone who really had little interest until my college years in political things, one of the ways that I felt it was important to get involved is through volunteering. So through volunteering, I found that I was empowered to grow my understanding of the political process, the electoral process, the legislative process, and I felt like I had a stake in it, even more than I did as an observer who may have the ability to go vote, but then otherwise didn't do much other than follow the news. So if you have an opportunity to lend a few hours, either to volunteer with your state, your state elections department, they usually are looking for people to help with the polls. If you have an opportunity to even volunteer as an intern or otherwise help with work that is needed at the district office in a legislative or elected official's office, or even volunteering if you see that they are helping with an upcoming parade or other kind of local festival or event that they're usually involved in, offering to be of assistance and being there, I think, can make a big difference. If they see your face and they recognize you a couple of times, they certainly make more of an effort to ensure they listen to your concerns. However, if you're not comfortable in volunteering in those ways, it's still important and a duty of the elected official to respond if you send them a letter or give them a phone call or otherwise share your opinion with them. The one thing that can be frustrating is that you might not hear back, but if you continue to kind of have a conversation with yourself through those letters and those calls, knowing that, okay, eventually someone's going to respond, oftentimes they will. And if they don't respond through email or through phone, if you show up to their event and you say, hey, I'm the one who kept writing letters on XYZ, somebody will know you. So we don't think about the importance of relationship building because we feel as small and, just tiny, tiny kind of beings compared to the great vastness of an elected office. But please know that you dismissing your power and your worth in the process of policymaking is common, but does not have to be the way that you approach it. Your perspective can be, they really need to hear from me because there's 1,000 other people that they're not hearing from. And I can be a voice and represent those people, even if it's just, once every 6 months or twice a year or what have you, a couple of times a year. I think, really being empowered and not diminishing your voice on behalf of many others is an important thing to know.
That's awesome, both of you. I'm so inspired. We're almost at time, so I want to ask a quick question. Yeah, people are happy in the chat. Someone at I lost the ability to scroll. Okay. Someone at oh no, I'm lost in the I'm lost in the chat. Someone asked about tips for how to request or frame these types of meetings, and then we will close. But quick wrap up question.
Sure. I'll just say that MHA has an advocacy toolkit on our website, which has language that you can use to send an email. You can just copy paste that template into an email and then finesse it and add your own thoughts. The basic information that you want to put in a scheduling email to your member of Congress or your state elected official is your name and address, so they know that you're a voting member of their district. And then a little bit about the topic and why you think it's pressing for them to meet with you now. Once you have those couple of sentences in there, you can send it off and then maybe wait a couple of days and follow up with a phone call to see if they received it and have started the scheduling process.
I think those are terrific tips. I think accountability is really important. So if you're not getting the response that you think you should be getting, there are a number of ways for you to hold elected officials accountable, and voting is a critical piece of that. So you won't always get the response or that you want, but you have power, and you shouldn't underestimate that power. When you're not happy with how your elected officials are responding.
Thanks so much, David and Karen. This has been super valuable. I see the chat people also found it super valuable. Thanks for demystifying some of this really complicated information that can be, even just like the words, it's like, sometimes I'm like, oh, I don't know what, I can't, there's so many words in that sentence that I've almost never heard in my life. So really appreciate you all making it accessible for more folks. And yeah, thank you to Jill and Madison. Diana had to log off. She's in the UK. She was like, hey, it's 1:30 in the morning, which I did not realize. So passionate all around about really talking about and advancing parity and access to mental health support. But thank you all so much. As we mentioned, I think Jackie has put the link to certificates in the chat a few times. We're going to send out the recording tomorrow to everyone who registered, and would really encourage folks to, like I mentioned, Karen talked about volunteering. Biggest predictor that someone will get involved is knowing someone involved. So challenge yourself to send this information to a few of your friends, even if it's not the recording, just the link to comment. And I'll give Jackie a second to drop that link in there. I'll drop the comment link another time. And yeah, thanks for spending your evening with us. And this is our first time doing a town hall like this, so hope you enjoyed it, and thanks for being here.
Thank you all. Have a good evening. Thanks, Kelly.